Welcome, everyone. Thank you so much for joining us tonight, for taking precious time out of your evening to attend the Amplify Georgia Roundtable, More Than Ever, the Fight for Reproductive Justice in Georgia. It is in the spirit of more that we come together tonight, seeking more connection, gathering more information, and demanding more from our governments for our community. Since you're here, you likely already know what's at stake. Trump came into power just a little over 2 weeks ago, and we are already feeling the impact. ICE is rounding up immigrants, funding is being frozen in order to root out diversity, equity, and inclusion efforts. Federal civil servants are being demonized and pushed out of their jobs, and new tariffs have gone into effect, which are sure to increase the cost of basic goods for families already struggling. Meanwhile, the Georgia legislative session is in full swing, and the very first bill legislators introduced is an anti-trans sports use bill. This is while pregnant Georgians die at alarming rates, while rent continues to rise, while chemical plants pollute our air and water with no consequence. Rather than addressing public health, poverty, environmental degradation, the ruling party in Georgia prioritizes hate bills that attack young Georgians and their families. This playbook is not new. They continue with these tired tactics of division. They double down on their messages of hate. They undermine the very democracy and freedom they claim is central to their party, because thus far, it has allowed them to hold on to power. So what do? We dream, we plan, and we dare to ask for more than ever. It is a radical act, especially in the South, to demand more than the status quo. This is why we refused to return to Roe. With Roe in place, abortion was technically legal under federal law, but for far too many Georgians, this basic healthcare service was out of reach. Now that Roe is gone, we have the opportunity to replace it with something better, with laws that serve all Georgians, not just the privileged few. The Amplify Collaborative was created for this moment. Back in 2017, Georgia reproductive justice organizations came together, exhausted from the constant fight against backsliding at the state level. We decided it was time for something different. We created the Amplify Georgia Collaborative to lead proactive policy change. And one of our first goals that we set was to secure abortion funding from the city of Atlanta. At that time, it felt like a distant dream, but we followed that dream with strategy. In over 5 years, we achieved incremental wins. We started with the Reproductive Justice Commission. Then we established March 10th as Abortion Provider Appreciation Day. And finally, in 2022, we secured $300,000 for Georgia's only abortion fund. So, in the spirit of demanding more, we are here tonight. We will begin this roundtable learning about the current state of reproductive health in Georgia and the ways that everyday Georgians are being impacted by our 6-week abortion ban. We will then hear about the threats and opportunities of this moment in which we ground our work. Next, we will present the Georgia Reproductive Justice Policy Agenda, defining our goals and providing a roadmap for how we get there. And finally, we will hear directly from legislators about what they're seeing in their districts and how they plan to respond. We hope that this is a lively conversation. We encourage you to use the Q&A tool in Zoom and to capture your questions throughout. We'll do our best to respond in writing and then address any remaining questions at the end of the session, time permitting. And before I transition us into our grounding, I realized I didn't introduce myself, so I'll start there and just say my name is Allison Kaufman, and I'm the Executive Director of the Amplify Georgia Collaborative and will be shepherding us through our agenda tonight, so popping in and out to just introduce speakers and give us a little bit of context and grounding for where we're heading. So with that, it is my absolute pleasure to hand over the mic to Reverend Esty, who is a spiritualist, scholar, ancestral storyteller, and queer sexologist. Esty's work is harnessing the way that theological formation, embodiment, sexuality, ancestral spiritual care, and ritual transform wellness. Reverend Esty currently brings her intersectional expertise in sexuality, theology, and program intervention and development to serve the reproductive justice movement as a faith coordinator for Sister Song Women of Color Reproductive Justice Collective. We are so lucky to have you here tonight, Reverend Esty. With that, I hand it over for your grounding.
Good evening, everyone. It's pleasure to be with you. I'm glad that we are all in this space. I want to open us up with just a word of gratitude. So I would love it for those that can, and it's safe because I know many of us are often in movement while we're in movement. I would love for us to put a word of gratitude in the chat. Just drop a word of gratitude in the chat. We give thanks for our presence. We give thanks for your presence. We give thanks for the bodies that the Creator has given us. We give thanks for those that we love. We give thanks for the food that we eat. We give thanks for the water that we drink. We give thanks for the many, many things that we continue to look for, seek, fight, and rightfully advocate for. We also thank God and our ancestors for the many, many things that we have that support us, that love us, that nurture us, and that allow us to be. All right. So I want us to take a moment and really take a second to get into our bodies after today, after the last couple of weeks. Thank you, Allison and Amplify, for creating a short moment for us to ground. So I want to invite us to kind of sit and rest on our bottoms, to plant our feet, and to allow your hands to rest comfortably in your lap with your palms facing up. And just take a couple of deep breaths in and out, noticing your natural flow of breath. Just take a few deep breaths in and out. Feel free to come off camera if you would like. That will support you. In and out. One more inhale and exhale. I want you to just kind of take a moment and really rest into your sitting, rest your feet onto the ground with intention. Feel the ground under your feet. Feel the chair under your bottom. You are supported. You are connected. You are supported. You are connected. I want you to take a moment and imagine that there's a string that is coming from the bottom of your feet that is buried down into the ground. Imagine that it's like your feet are so deeply planted that they are tethered to the earth in this very spot. And remember that this land has power. Mother Earth supports us every day. There is something under you, there is something over you, there is community around you. And take a breath. Take one more breath. I want you to take a moment and just kind of rotate your head and your neck from side to side. Just feel yourself, even rotate your shoulders if you need to. And as you're doing it, intentionally feel water rolling off of your back like a duck's back. And imagine water rolling away from you. You are here. You, exactly who you are, exactly who the Creator created you to be. You, your destiny, your spirit, your gifts, your quirks, your beauty, your mastery of a representation of the power of source of the divine, your beautiful manifestation of the universe. You are here, right here, in this moment. And we are with one another. There's more around us than we feel sometimes. So I want us to take a moment and feel that surrounding of our spiritual support, of our guides, to remember loved ones that we haven't seen in a while, to remember our ancestors, to remember our community members, to remember those folks that take care of us at home, that may be thinking of us when we think of them. You are here and you are not alone. You are here and you are powerful. You are here and you are surrounded. You are here and you are grounded on this earth to bring the gift that is you. And for that, we are thankful. Ashe, Ashe, Ashe. Oh. Closing deep breath. Blessings to you all.
Thank you so much, Reverend Esty. We are here. We are surrounded by each other. And we are going to move the conversation forward in Georgia and move the fight forward together. Thank you so much. I'm feeling more present and just very appreciative to be in community this evening. So with that, we will be moving into the part of our conversation where we discuss the current state of reproductive health care in Georgia. And we hear directly from folks who are on the front lines, like seeing the way that our abortion bans and other restrictions are impacting access to reproductive health care in our state. So we are going to first begin with Allison Glass, our Amplify's state campaign director, who will be sharing some data and information about the reproductive health of Georgians, and some of the laws that are impacting our healthcare access, and then transitioning directly to that conversation from people on the front line. So to begin, Allison Glass.
Thanks so much, Allison Kaufman. Um, it's so good to be with you all tonight. Thank you so much, Reverend Esty. Oh my goodness, that was so beautiful and so needed. So here we are going to start talking about getting grounded in where we are in the state of Georgia, the health context. And here's what we know. Georgia has one of the highest rates of maternal mortality in the country. Black birthing people are 3 times more likely to die than their white counterparts. And that is with controlling all other factors such as income, education, and zip code. We know that this is due to medical racism. Black babies die at nearly twice the rate of white babies, and the majority of these deaths are preventable. Many factors influence these high rates, including Georgia being having the fifth highest rate of uninsured families in the country. 1 in 8 Georgians are without health insurance. And even if people have health insurance, far too many people don't have a nearby hospital to go to. 18 of the 30 rural hospitals in our state are at risk for closure. And we know all too well the impact here in Atlanta with the closure of the Atlanta Medical Center, which was a critical facility for people giving birth. Georgia also doesn't have enough medical providers. 95% of Georgia counties have no abortion provider. More than 50% of Georgia counties don't have an OBGYN, and 40% of Georgia counties don't have a pediatrician. So I'm going to zero in for a moment on abortion restrictions and what is current here in our state. Georgia is one of 6 states with an abortion ban at around 6 weeks. This was HB 481, which was passed in 2019, which outlaws abortion after fetal cardiac activity, which is around 6 weeks, since the first day of a person's last period. It also established personhood for fetuses. And then Georgia had even more restrictions that was passed, including, excuse me, including a mandatory waiting period, inaccurate state-mandated counseling, a ban on using public insurance to cover abortions, parental notification, and a requirement that only physicians provide abortions. All of these factors mean that the vast majority of Georgians now have to travel out of state to access abortion care. In addition to these severe restrictions, our state isn't providing people in the families they have with what they need. Georgia is one of only 10 states that hasn't fully expanded Medicaid. 78% of Georgians don't have access to paid leave to care for themselves or their families in times of need without risking their jobs or their paychecks. And Georgia has one of the lowest minimum wages in the country at $5.15 an hour. And that is for folks who don't qualify for the federal $7.15, which is still abhorrent. Poverty, coupled with the lack of affordable or accessible health care, puts far too many Georgians' lives at risk. But of course, we know that Georgians, the folks that are the most impacted by these shortages and restrictions, are Black, Brown, Indigenous, LGBTQ, young, poor, rural, immigrants, refugees. We all deserve so much more. And I'm so honored to be a part of this roundtable to discuss these issues more in depth and to find the solutions together.
Thank you, Allison Glass, for that essential context as we transition into the roundtable portion of tonight. So it is my pleasure to introduce 4 incredible speakers who will be sharing what they have directly observed and experienced since the implementation of HB 41 in Georgia a few years ago. Our first panelist, our first speaker is Dr. Zoe Lussier-Julian, director who is a community-rooted clinician, scholar, teacher, and organizational leader in reproductive health and justice spaces in Atlanta. They currently serve as the first director of clinical innovation and liberatory research at the Feminist Women's Health Center. And they will be sharing a little bit more about what providing reproductive health care and specifically abortion care looks like in our state right now. And next we will have Kenny Calloway, who is a Healthline coordinator at Access Reproductive Care Southeast. For 6 years, they have supported abortion seekers with their appointment, funding, and travel support. They enjoy sewing and exploring coffee shops around Atlanta. And they will be sharing what they have been hearing from ARC scholars as they support them to access abortion care both in Georgia and across the U.S. Next, we will have Dr. Elizabeth Mosley, who is an affiliated faculty member at the Emory University Rollins School of Public Health at the Rye Center of Reproductive Health Research in the Southeast. She is a community-engaged researcher focused on reproductive health equity, including abortion access. She is also a community-based full-spectrum doula, providing prenatal, birth, postpartum, and abortion support to pregnant people in Metro Atlanta. And Dr. Mosley will be sharing data about the impact of Georgia's 6-week abortion ban. And then finally, we're being joined by Danielle Rodriguez, who is a dedicated reproductive justice advocate, facilitator, and strategist committed to shaping policies, movements, and spaces that center Black, Brown, and queer communities. As a Georgia program coordinator at Sister Song, she works at the intersections of maternal health, abortion access, and discrimination of pregnancy, fighting to dismantle systemic barriers to reproductive freedom. And Danielle is here tonight to share more about what she's observed as an advocate and organizer in Georgia and lift up some specific stories of the impact of this ban in our state. So those are amazing speakers. I'm going to hand it over to Dr. Lussier-Julian to kick us off.
Thanks, Allison. Good evening, everybody. Again, my name is Zoe Lucier Julian. I use they, them pronouns. I am a board certified obstetrician gynecologist and have the privilege of serving at Feminist Women's Health Center as both an abortion provider, as well as a clinical and research leader in our community-based organization. As many of you know, since the Dobbs decision came down and protections under Roe versus Wade fell, we have been subjected to essentially a 6-week abortion ban or a 6-week limitation in abortion here in Georgia. Our current law stands that we're unable to provide abortion at any point where fetal cardiac motion is detected on an ultrasound. That usually occurs around 6 weeks in a pregnancy. We have a few exceptions to that law, inclusive of ectopic pregnancy, if a pregnancy is deemed medically futile, which is not very clearly specified in our law, as well as pregnancies as the result of rape and incest, which require folks to file a police report in order to safely and legally seek care, as well as pregnancies that are deemed medical emergencies for the pregnant person, again, which is not provided with any specificity on what is deemed a medical emergency from that legal definition. So as a result, because of this inhumane law, which important to note was already in effect prior to the incoming administration, our patients have to make life-changing decisions about their care and their bodies and their families before most people even know that they're pregnant. They make these decisions in the context of everything that both Allison's named. They make those decisions in the context of a worsening obstetric provider shortage and limited midwifery scope of practice, worsening maternal mortality rates, continued legislative attacks on queer and trans folks who also, in addition to their cis women counterparts, rely on safe and legal abortion, as well as racialized violence at the hands of both militarized police, as well as we've seen emboldened immigration officers. We're having conversations actively in our clinic about how do we protect patients from criminalization, both in our own practices as well as those seeking to harm patients coming into our spaces. It's a really morally and ethically eroding position to be in as a physician in these circumstances. I'm forced to break my professional oath to do no harm, and I'm forced to deny safe, compassionate, and high-quality abortion care to people who need and deserve it. I think it's important, too, to draw clear connections between abortion and gender-affirming care. To me, they are one and the same. Abortion is gender-affirming care. Gender-affirming care is inclusive of abortion and much more. And we know that folks coming to our clinic at one point in their lives may be seeking gender-affirming hormone therapy. At another point in their lives, may be seeking an abortion. And at yet another point, looking for safe and reliable opportunities, experiences, and providers to continue pregnancies and grow their families. So to think of these issues as affecting one community distinct from another is just simply untrue. Our communities deserve more than simply the protections that Roe and versus Wade enabled. We all deserve reproductive justice, which we know affirms the right to bodily autonomy, to determine if, when, and how we build our families, and to care for our families in safe and sustainable communities. When any human being is oppressed, exploited, surviving genocide, surviving fascism, and are unable to enact these rights, then reproductive justice is not realized. Our collective liberation is not realized. That is true here in our country, as well as many abroad, inclusive of Sudan, Haiti, the Congo, Tigray, and Palestine. And so certainly legislation is necessary to protect the right to abortion. And I'm encouraged to hear what our fellow legislators, have to share about their viewpoints, their experiences, and their work towards that effort. But I would be remiss without urging everyone on this call to share within your communities and your spheres of influence the importance of supporting local clinics, of supporting local abortion funds, of supporting local community-based advocacy organizations and doing all that you can to make reproductive justice a reality in our lifetime. You heard from Allison Glass about the extensive provider shortages throughout our state that not only threatens people's access to care, it also threatens our reproductive health care workforce. Many providers don't see Georgia as an attractive place to remain or to come to when it comes to providing reproductive health care because your wings are clipped and your ability to do what you're trained to do is severely limited. This also has direct impacts on our ability to train the future workforce. So folks who are currently in health professions training programs, whether they be midwifery students, nursing students, medical students, resident physicians, physician assistants, and others, their training is being impacted by this incredible squeeze on our ability to provide care. So as you can see, the law does not just impact our communities and patients directly, but also indirectly as it impacts the workforce, both clinical workforce as well as our research workforce, which I'm sure Dr. Mosley can also speak to. Despite this grim picture, I think it's really important to lean into gratitude that Rev offered us in the beginning of the call, to recognize that there are nearly 100 participants on this call alone, which is incredibly encouraging to me. I'm encouraged by the people that I get to care for. I'm encouraged by the ways I get to celebrate their accomplishments in realizing their bodily autonomy and being able to make the choices that they want to make for their bodies, for their families, for themselves. And I know that we can continue that work. We must continue that work. We are capable of realizing our goals. And as Allison urged us in the beginning of the call, now is not the time to play small. Now is not the time to move in fear, but rather to be as expansive and courageous and bold as our imaginations allow us to be, because we simply have nothing to lose. Thanks, everyone. Looking forward to the other panelists' comments.
Thank you so much. Next up is Kenny.
Hey, y'all. If you see me looking off to the side, it's because I was so nervous about speaking to everyone today because the gravity of what our callers are dealing with, it felt like it was very important to get on to paper so I can speak to you today. So I'm happy to be here. And I'm so happy to hear all of the amazing things and support our fellow panelists are giving to our callers. So I guess I'll just start with the truth is that people are traveling further and further away just to receive the care that they need. Now, the Georgia 6-week ban and the bans throughout the Southeast have meant that people had to travel. People think they have to travel to DC, North Carolina, Colorado, New York, Chicago because of the misinformation or how intentionally misleading the Georgia 6-week ban is. Most callers we speak to don't know if 6 weeks starts at the start of a pregnancy test. Does the 6 weeks start from when their period would have come on, or does the 6 weeks start from their last normal menstrual period? And so I've had callers think they need to go all the way as far as California to receive abortion care after 6 weeks, when often they can receive care as close as Virginia or even North Carolina. There is one group of our callers that I'm very concerned about, and it's young people in Georgia. Overall, I've seen more young people call in with their parents or family members, and that's really heartening. It means that this ban is even more unpopular than I previously expected. But I've also seen, we've had like a dozen calls where parents or family members are pretending to be the young person in question because they're worried that ARC won't provide support for the young person because of their age. And it's the stigma and the misinformation that makes people It makes young people and their family members so desperate for them to receive reproductive health care. I I remember being shocked when I had a parent ask me if their teen's abortion will impact their ability to go to college. And of course, I had to explain to them that colleges are not and cannot access the information to see if an applicant has had an abortion in the past, but these bans, they contribute to that misunderstanding and that desperations people have, especially young people have around receiving care. It means it means young people have to travel and miss school or miss an internship or just be away from their friends and family when they really need community care in their time for seeking an abortion. It can it can be bad, like it can be detrimental to their mental health because they might think they're doing something wrong because the state is saying you cannot receive the care you need after this point. I have also seen less young people calling in with their families, and I'm not sure what to make of it. I don't know if that means parents are being more active in trying to do everything that they can. I don't know if this means people are giving up before they even reach out to us if they can receive care. And I I speculate because, the heightened anxiety due to our climate, I'm just worried that a lot of young people have parents or families with anti-abortion sentiments, and this prevents them the ability to receive an abortion. So I'm trying to remember all of the things I could possibly tell. It takes a lot of time to receive an abortion after 6 weeks. It takes time out of work. People are worried if they can receive childcare. I've had people delay their abortions because their babysitter can't come in after 1 week or 2 weeks. And as you know, as you become further along in your gestation, this means the price of the abortion goes up. This means you might need to stay in the city you're receiving your abortion longer. That is another expense to your care. That is hotels, flights, food, gas. I have had people drive 6 hours, 8 hours, 12 hours to receive an abortion because they couldn't receive an abortion after 6 weeks here in Georgia. I'm I'm most worried about young people in rural Georgia because as it's mentioned before, we live in a care desert. We don't have a lot of hospitals or clinics. So if a young person is living in rural Georgia and they don't have a supportive family, they can't miss school. They can't leave home. They might not have access to a car and certainly not any gas money to go to Atlanta or Augusta or Columbus, and especially not out of state. So, what I'm expecting to see is more forced teenage pregnancy. I'm I wouldn't be surprised if we see more young people who drop out of high school, who delay college, or who can't think of any other career opportunities because they're forced to carry to term. Now, this ban has meant that there are severe mental health implications or adverse outcomes for people, but it also means that people will have worse education and economic opportunities. And this is especially true for the young people of Georgia. And I think that was all I had to say. I thank you guys for listening. I'll pass it back to Allison.
Thank you, Kenny, for sharing that heartfelt report from what you're seeing on the Healthline every day, and seeing a lot of what Dr. Lucia shared and what you shared, just a lot of similarities and connections there, and also just really feeling the theme of folks having to grapple with so many intersecting issues at once, right? And it going so much beyond abortion access. So thank you. So next will be Dr. Liz Mosley, and I will be sharing some slides since Liz is presenting research, and it's very hard to retain information without a visual complement. So handing it over to you, Liz.
Thanks, Allison, and thanks for humoring some slides. You know, a professor can't help herself. Wow, really humbled by my other co-panelists and incredibly grateful to be here today. I want to name that I am one of those rural kids. I grew up in Vidalia, Georgia, and then moved to Savannah and spent high school there. So just thanks for all that you're all doing for everyone across the state. Allison, you can skip ahead. I had sort of an outline slide. I'm happy to share these with y'all later too, because I reference a lot of studies that you might want to follow up on. But you can go ahead past the maps because other Allison did such a great job of teeing us up to understand, you know, the dire situation that we're in nationally, but also here in Georgia, and especially listing out the multiple policies that people are impacted by right now, not just our 6-week ban. And so I want to focus, maybe if you go to that next one on, yes, that's it, on how restrictive abortion policies impact health. And I will name, I'm focusing these slides on health impacts, but my other co-panelists have explained how there's many socioeconomic impacts, psychological impacts. But for today, these are the health impacts that I'm focused on. So we know that these abortion restrictions collectively, in that layered way, severely reduce access to abortion care. Second, they increase the negative health outcomes, maternal and infant health outcomes. And third, these policies disproportionately affect people with the least amount of power in our society, including, as others have mentioned, Black and Brown people, other people of color, Indigenous groups, younger people, people with fewer socioeconomic resources, those of us who are chronically ill and disabled, and people live in rural areas. You can go to that next slide. Abortion restrictions reduce access to abortion care by decreasing provider availability, as we've heard. And that means, again, decreasing not just abortion providers, but all OBGYNs, midwives, and nurses who are being affected by these infringements on their scope of work. And the restrictions also make it difficult for people to get appointments. It increases travel time, increases the distance to clinics that we need to travel, and ultimately increases all of the costs associated with abortion care. And ultimately, that results in delayed care, or more and more, as we're seeing, completely denied care. Next slide. So looking at some data from before the 6-week ban, our team at RISE, in partnership with Amplify, found that 88% of abortions occurred at 6 weeks or later in Georgia. I'll say that again, before HB 481, 88% of abortions were happening after that line in the sand that they were drawing. So we anticipated that in a worst case scenario, HB 481 could outlaw nearly 90% of abortions in our state. Next slide. These are some data from the Society of Family Planning's We Count study, which is finding in Georgia specifically that the number of abortions in our state since Dobbs, since our 6-week ban went into place, abortions have actually decreased by about 45%. So access has been cut in half here in our state. Next slide. Bans on public insurance are particularly devastating because 75% of abortion patients nationally are low income. That's a double bind because research also shows us here in Georgia that abortion patients often can't afford the out-of-pocket costs of abortion, which are now averaging $500 to $2,000, much less the cost of rearing a child. One woman in a qualitative study told us they're forcing people to have children that we can't afford. Next slide, sorry. The mandatory waiting periods also push people later into pregnancy. In Georgia, that's a 24-hour waiting period after you listen to inaccurate counseling that might make you second guess because of the stigma that's baked into those counseling sessions. When we push people later into pregnancy, of course, that increases the cost, and it often pushes people beyond these state gestational age limits. And the delays from one study we found, the delays can increase the percent of abortions in the second trimester by 50 to 70%. Next slide, please. Parental involvement laws are especially harmful to minors because they reduce the efficiency and the timeliness of abortion care. It reduces the patient-centeredness by introducing parent dynamics into the clinical decision-making, and some parents are not going to be supportive of these decisions. We know that these parental involvement laws also inequitably impact lower income families and families that have non-traditional structures to them. So trying to find people who are guardians but not parents can be very difficult and delay care even further. Next slide. There's a strong evidence base showing that abortion restrictions increase poor health outcomes. You should be able to read each of these studies if you want afterwards, and I'll go through just very quickly that we know abortion restrictions increase negative birth outcomes. It increases preterm birth and low birth weight. It can actually increase infant mortality at the state level and increase risk for individuals. And we know that it increases maternal morbidity and mortality. In states that have gestational age bans, this was a study conducted several years ago, there was a 38% increase in maternal mortality in those states. Next slide, please. Evidence also consistently shows us that restrictive abortion policies have the greatest impact on marginalized communities and that they increase health and social inequities. Next slide. For example, we know that bans on public insurance coverage for abortion obviously inequitably affects patients who are lower income, but we also know that people on lower income and needing public insurance are more likely to be Black or Hispanic because of structural racism and poverty. Next slide, please. And from our own work with Amplify and at RISE, we know that gestational age bans like Georgia's 6-week limit have larger impacts on people who are younger, people of color, and people living with fewer socioeconomic resources. Next slide, please. And ultimately, those inequitable impacts on abortion access lead to greater inequities in health outcomes. As we've mentioned, Georgia is already experiencing a maternal mortality crisis, and outlawing abortion only makes this worse. I've pulled together some numbers here. These haven't been published, but we're working on getting them out there. If we assume that all groups in Georgia experience that 45% decline in access, and if we assume that everyone who doesn't have access in our state can't get it out of state, let's imagine that all of those pregnancies are carried to term. If that happens, we would expect to see 1 additional white maternal death each year and 4 additional maternal deaths among Black people. That's a 12% increase in Georgia's maternal mortality overall, and a 17% increase for Black people. And this kind of statistics are only from carrying the pregnancies to term, because pregnancy is 40 times more dangerous than abortion. And for every maternal death in our state or anywhere, there's about 70 to 80 near misses. And so these numbers are catastrophic. I have a few more slides about expansive policies, but the next roundtable that we get to will actually cover some of this. I'll end today by just saying that we know there have been deaths directly from the abortion ban in Georgia, including Amber Thurman and oh my goodness, I've lost my slide, and Candy Miller. But one thing that's come out of these ProPublica articles about these deaths from the abortion ban is that because of the leaked information, our Georgia Maternal Mortality Commission has been disbanded. There's conversation that it will be put back together, but you can imagine right now is a critical time for data collection, and we're missing a really important window to understand the impact of Dobbs on maternal deaths. Thank you so much, Allison. I'll leave it there.
Thank you so much, Dr. Mosley, for sharing all of that information and for the offer to share links to these resources, to studies, so that folks can educate themselves on the true impact, because there's so much data that you and the researchers you've been working on have been putting together to make the case against these bans. And our final speaker in this portion of the roundtable is Daniel Rodriguez from Sister Tom.
Wow. Thank you to my comrades, and thank you, Allison, and hello, everyone. As an advocate working in this state, I think Georgia is facing a moment that demands our attention and focused attention and focused action. Right now, we are at a crossroads where maternal health, abortion access, and criminalization are colliding in ways that deeply impact BIPOC pregnant people and families. And if we are going to win, we have to see these struggles as interconnected. Reproductive justice is not only the fight for abortion rights, it is a unified fight to have children, to not have children, and to raise our families in safe and sustainable communities. And here in Georgia, all of those rights are under attack. So we know that Black women in this state face some of the highest maternal mortality rates in the country. We also know that abortion bans and restrictions don't protect life. They put people's lives at risk by denying them access to essential health care. The same systems that block abortion care are the ones that refuse to fund Black midwifery, ignore the maternal health crisis, and fail to support people in their pregnancies and parenting. And then there's the criminalization of pregnancy. The way the state polices, surveils, and punishes Black and brown people at every turn, whether through the prosecution of pregnancy outcomes, the removal of children from loving homes, or the incarceration of people simply trying to survive. There's no theoretical, it's real, it's happening to our people, and I think it's important to go into detail of the tragic deaths of Amber Thurman and Candy Miller, whose stories remind us what is at stake. Amber Thurman's story is a devastating reminder of what happens when abortion care is restricted and healthcare providers fail Black women. Amber was a 28-year-old mother in Georgia who, like so many others, sought care out of state after being denied access to care. She took abortion pills, which are safe and effective, but then experienced complications due to a retained fetal tissue, a condition that requires urgent medical attention. Amber did what she was supposed to do. She sought care at Piedmont Henry Hospital, and the hospital failed her. For 20 hours, Amber was left waiting while doctors delayed the necessary procedure, a DNC standard treatment for incomplete abortions and miscarriages. That delay proved fatal. Amber developed a severe infection and died because she was denied timely care. Later, the Georgia Maternal Mortality Review Committee confirmed that her death was preventable, that she should be here today raising her child, living her life. But in Georgia, Black women's pain is ignored and our lives are dismissed. Candy Miller should be alive today, too. She was a 41-year-old mother of 3, living in Georgia with chronic health conditions that made pregnancy dangerous for her. When she unintentionally became pregnant in 2022, after Georgia's 6-week abortion ban had taken effect, she faced an impossible choice. Because of the state's abortion restrictions, Candy ordered abortion pills online and took them at home. But when she experienced complications, she did not seek medical care, not because she didn't need help, but because she was afraid. Her family later shared that she avoided doctors due to Georgia's abortion laws because she feared being criminalized, stigmatized, and denied care. She suffered in silence, and then she died. Again, the State Maternal Mortality Review Committee later determined that her death was preventable and that Georgia's abortion ban contributed to it. Let me be clear, abortion bans do not protect life, they take life. Candy and Amber's story is not just a tragedy, it is a warning that we cannot let fear replace care. We cannot let politics dictate who lives and who dies. No one should have to risk their life because they are afraid of being punished for seeking health care. This is why reproductive justice is a life or death issue. What I've learned is this: there's no separating abortion access from maternal health. When abortion is banned, people are forced to carry high-risk pregnancies that increase their chances of dying in childbirth, especially Black women. Georgia's maternal mortality crisis is not accidental. It is a result of policy choices. Choosing to ignore Black women's pain, choices to underfund healthcare while expanding policies, chooses to punish rather than to support. And when the state treats pregnancy as a crime, it puts every pregnant person at risk, especially Black and brown people, poor people, and those already marginalized. So this is why we're here today, and this is why this policy agenda is not just necessary, it is urgent. As an organizer here in Georgia, I know we are not powerless. So we are demanding policies that stop the criminalization of pregnancy. We're demanding abortion access that is protected and expanded, maternal health solutions that center Black birthing people, including midwifery and community-based care, and an end to state violence against pregnant people. So tonight, as we talk about the landscape people face in Georgia, I hope each person asks themselves, am I ready to stand up with the movement and fight? Because this movement isn't just about those of us who are speaking today. A movement is about all of us together, and it's going to take all of us to win.
Thank you so much, Danielle, and everyone on this panel for sharing, honestly, some very sobering information about the current state of access in Georgia. And Danielle, to hear those stories and really make it real, what the impact of criminalization is specifically on pregnant people and specifically Black pregnant people in our state. So now we are going to transition to talk about some of the opportunities. I think it can feel a little bit overwhelming at times, all of the obstacles, all of the barriers that we face. And there are still opportunities in this moment to advance change and to demand more. And my colleague, Rula Abisamra, is going to be highlighting some of those opportunities that we are grounding our specific policy agenda in.
Thank you so much. Can you all hear me okay? All right, thanks. I am so grateful for what we've heard from our first four speakers today. It ties together for us some of what we've been seeing around as we think about the strategies to go forward in the landscape that we face. One of the very first things I want to highlight is that, contrary to what many people may think, those who are calling for change and who are calling for reproductive freedom are in the majority in Georgia. Polling in 2024, and we can now confirm that this is also reflected in new polling from January 2025, shows that about 70% of Georgians support abortion access. We can break that down in terms of policy positions, but what is even stronger than that, and I'd like to make sure that people know, is that about 80% agree that the government should not interfere, not just with our reproductive decisions generally, but if you ask about decisions to have an abortion, 80% agree the government should not be interfering. Most Georgians, 3 and 4, think the best person to make a decision about abortion is the person who is pregnant. Whoever else they choose to involve, sure, but the person who is pregnant. And that is so far from what we currently face in terms of our laws, our policies, and the systems in place. So just the wrap up to that is that Georgia's current laws on reproductive health are not what Georgians want. And many of our elected politicians are out of step with the will of the people at large and the will of the people they represent in their own districts. Although they're continuing to advocate for even more abortion restrictions and for more bills that regulate our bodies and our reproduction and that take away our resources, our polling shows that that's not what we want. Our polling shows we want less government interference in our reproductive choices and more attention to the supports and resources that families need. I would be very excited to share this resource in the chat when we're finished. One piece I want to pull out from that polling is that 71% also said that they want Georgia to pass a law that protects Georgians' right to choose to have an abortion, to remain pregnant, to give birth. That is what we want, is our rights respected and enshrined. So I think we are the majority and need to think about leveraging our collective power for change. What does that mean, though, in the current context? We think that change needs to happen locally. We have said this for a really long time. It needs to happen at the more local levels when, especially, the landscape at the federal, the national level, which is what makes the news a lot of times, is not looking good for advancing what is really needed by people in our country. So with Trump's re-election to the White House, with Republican control of Congress, those two things put together, there's not much chance of winning abortion protections at the national level in the next few years. And we might well have to organize to stop new federal policies that would make matters worse. But while we are organizing there, the shift in power at the federal level means that, once again, our work to advance reproductive justice needs to happen closer to home. Amplify was actually created for this moment in 2017, and we will continue to champion positive change in our cities, in our counties, and in our state government. That is not going to change. In fact, now is the time to invest in long-term strategy. We are going to double down. It took the right almost 50 years of work to overturn Roe versus Wade. And so we need to make a similar investment to achieve reproductive liberation. We've always known that. Liberation comes at the cost of thinking long-term and building with each other now and for the future. And so the policy agenda, when we're launching it today, it's one piece of the strategy. It's saying these are the policies that Georgians want and need now, that Georgia politicians could pass now. And those who are seeing the future and who are seeing the need around them are getting on board and are saying, this is what we need to work toward, not whatever it is that this status quo is. So we need to unite to win. And when I say that, I mean not just those who agree on any one issue, but those who see that our humanity is connected to each other and that most of the time we don't live single issue lives, as one of our speakers said. The 2025 presidential election and how that broke down really showed us siloing our issues is a recipe for failure. We don't silo our issues, and reproductive justice is inherently intersectional. There is no reproductive justice without economic justice or racial justice or environmental justice. And we have to unite around a shared agenda that speaks to many of us and speaks to the intersectionality of our actual lives. So coming together and fighting for collective liberation is how we are going to have the people power to win. And we're asking all of you to think about that and to believe that this starts now. It has started already, and we can come together, keep adding to this movement rather than think there is no way forward. There is. Thank you.
Thank you so much, Rula, for laying out the opportunities in this moment and that we are building this policy agenda on top of. So we will now share more about the Amplify Georgia's 2025 Reproductive Justice Policy Agenda, which we just recently launched. A bit of context about the agenda before we get into our specific agenda items and our roadmap for policy change. So this agenda captures policy changes that we need so that all Georgians can make decisions around our bodies, for our families, and with our communities. This agenda includes both Amplify run campaigns, but it also includes Amplify supported campaigns that get at more broadly reproductive justice and not just specifically abortion access, which is Amplify's focus. And while reproductive justice is infinitely expansive and intersectional, this agenda really focuses in on specific aspects, specific issue areas that we can advance with short and long-term proactive policy change. And I say that because there's such important work happening and especially really important defensive work happening, but this agenda will not capture that work because it is focused on proactive change and specifically proactive policy change that Amplify or our partners are a part of. And although this isn't comprehensive, I hope that folks can feel confident that the things that we have put in this agenda we are sure are going to help us to move the needle towards reproductive freedom in our state. And just a final note before we get into the agenda recommendations in particular, we recognize that policy change is just one of many tools that will help us to get to reproductive liberation. Policy change is not the be-all, end-all. And this document is specifically focused on legislative change. It is situated within a broader strategy that includes organizing, that includes education, that includes direct service provision, narrative shift work, and building systems and services outside of the state. So I just want to share that because policy change is not always for everyone. That will be our focus today, but there's also a much broader scope of work and strategy of work in Georgia that we are happy to connect folks to, should that be more aligned with your interests and how you're called to move in this moment. So our agenda is divided into 3 sections: our bodies, our families, and our communities. The first section, our bodies, is going to be presented by Agbo Ecor, the Policy and Advocacy Director from Spark Reproductive Justice Now, Amber Kitt, the Georgia State Organizer for Reproductive Freedom for All, and Brianna Lipscomb, the Senior Advisor for the Center of Reproductive Health Rights and the Center of Reproductive Rights. So they will be presenting the different policy recommendations, starting with the ones focused on abortion access. And the first one will be shared by Agbo Ecor. Handing it over to you.
Hi, I hope everyone can hear me okay. I'm so grateful to just be in this work for proactive policy change because I know living in the state of Georgia, a lot of the time we are playing defense. So it's such an honor to be able to push policies that will really help Georgians. So I'm here to talk about the Fake Clinics Suck campaign. So fake clinics, also known as crisis pregnancy centers, anti-abortion centers, fake abortion centers, things like that, a host of names, fake clinics. This campaign is a grassroots movement to defund these centers. So currently, Georgia gives about $2 million a year to anti-abortion centers. They passed this funding program in 2016, and since then, about 2 million, sometimes even more, have gone to anti-abortion centers. These are ideologically driven establishments that take our public funding to wrongly pose as unbiased health services, then give inaccurate and sometimes harmful information to pregnant people who are seeking support. So this campaign is shining a light on anti-abortion centers' deceptive practices and seeking to hold them accountable. So with that, this session, we're hoping to introduce the Pregnancy Center Fraud Prevention Act and eliminate that state funding. So we want to regulate anti-abortion centers like any other businesses, that they can't lie about the services they offer, particularly when it comes to pregnant people just seeking care. We don't want them to mislead consumers. And we want to eliminate that $2 million a year in state funding that is currently allocated to these unlicensed fake clinics. Ultimately, we hope to reallocate that funding to actual helpful resources. We've thought about reallocating it to TANF. I know the governor has a maternal health committee, or what's the word I'm looking for? Some maternal health work that would benefit more from these funds than anti-abortion centers. So to talk a little bit more about what these fake clinics are, their primary goal is to divert pregnant people from having an abortion. They are the storefront of the anti-abortion movement. They like to position themselves as, local, just church-run facilities that only seek to help pregnant and scared people, when that's not the case. This is really the face of the anti-abortion movement. And they're often affiliated with national religious organizations who oppose abortion, preach abstinence until marriage, and don't support access to birth control. So although many anti-abortion centers advertise or imply that they provide healthcare services, most of them only offer a very limited set of services, like pregnancy tests, free ultrasound, but those ultrasounds are often not provided by a licensed ultrasound technician. They do not follow medical standards for sexual and reproductive health care. Some of them are even involved in teaching sex ed in public schools. And in the state of Georgia, they outnumber actual abortion clinics like 5 to 1. So we really seek in this campaign to address the problem of anti-abortion centers, reallocate that funding, and at the very least, make sure that they can't lie to vulnerable pregnant folks who are really just seeking care. I'm happy to talk more about this campaign. If you're interested, we do have a petition. We do have the ability to get involved. Just let me know, and I'm happy to talk more about that.
Thank you, Agbo, and we'll be sharing ways for folks to connect at the end of the session. Next, over to Amber.
Hello, everyone. My name is Amber Kitt. I'm the Georgia State Organizer with Reproductive Freedom for All, and I am also one of the co-chairs of the Reproductive Freedom Act Working Group. LS, who couldn't join us, is the other co-chair. And I'm here to talk to you guys about what the Reproductive Freedom Act is, along with the campaign. I know we're short on time, so I'll just give a very short, history of the campaign, what this bill plans to do, along with some calls to action. And so, the Reproductive Freedom Act, it dates back to 2018. The RFA was actually first called the Reproductive Autonomy Act, the RAA, and it was visioned and led by staff of the Feminist Women's Health Center, which is based here in Atlanta, and one of the handful of independent abortion clinics, along with other services they provide here in the Metro Atlanta area. And so, the Feminist Women's Health Center, they anticipated the needs that the community had and knew that, what we had, Roe v. Wade, it wasn't enough. And they truly were dreaming bigger for Georgians. The next thing I wanted to share is moving on into the year 2020. This year was really used to kind of build the foundation of the bill, planning, researching, and also just building the foundation of what the RFA is now. And the RFA, which is the name now, that name change happened in 2021. Additionally, in 2021, that is when Texas abortion ban SB 8 took effect. And moving into the summer of 2022, our worst fears that, we were anticipating had came true with Roe v. Wade being overturned, and then Georgia being allowed to enforce HB 481, which is the 6-week abortion ban. Fast forwarding to 2025, specifically legislative session. We are reintroducing the Reproductive Freedom Act, and we plan on dropping this bill on February 24th. And so some of the things that the RFA tackles is the basics, enshrining fundamental rights and affirming that Georgians, they are individuals who have the right to decide how they want to plan their pregnancies. They have the right to decide to carry a pregnancy or to have an abortion. Additionally, the other thing that this bill tackles has to do with insurance coverage. Right now, Medicaid does not cover abortion care. Abortion-related care under Georgia's Medicaid, Georgia employee health plans, and then also the Affordable Health Care Plan, the Affordable Care Act plans, they don't cover abortion care. And them doing that is one, denying health care to Georgians, but on top of that, you're stigmatizing abortion care. Abortion care is health care, and it should be treated as such and be covered. Additionally, in terms of Medicaid, the Medicaid is given to folks who are extremely vulnerable and are low income. These are people that are most likely not even able to afford an abortion out of pocket, and therefore the need is very obvious. So this is something that the RFA tends to tackle as well, is just expanding that coverage. The next thing is we want to make sure that young people are taken seriously. So often when we are talking about abortion care, we are highlighting some of the most vulnerable people in our society, and that includes young people. Currently, there is parental notification. And so if a young person who is under the age of 18, if they don't have the support of a guardian or a family, a guardian or a parent, they do have to go in front of a judge that they don't know and pretty much ask for permission. Young people can be educated. Young people can talk to their own healthcare providers, and they are well equipped to make decisions on their own. We who are supporting the RFA, we don't believe that young people should be going in front of a judge and pretty much having to beg for care. It's unacceptable. And then the other thing that I want to touch on that's not on this slide is the other barriers that the RFA would be tackling are things like waiting periods, along with biased, state mandated bias scripts that have to be read by medical providers. These scripts are not based in like medical science. It's really there to make someone feel bad for the decision that they legally have a right to do. And also, it can cause tension between a patient and their provider. It's unnecessary. Additionally, in terms of the waiting periods in Georgia, there is a 24-hour wait period. That is ridiculous and unacceptable, especially when we are living in under a 6-week abortion ban. Time is so essential. And so to put people in a position where they are having to wait 24 hours, you're risking them having their one, not being able to make an appointment and delaying like necessary care. And so these are like the main points I wanted to talk to about the RFA. Lastly, I'll say like my calls to action and also when we are talking about the Reproductive Freedom Act, we are looking for something bigger than Roe. Even before the 6-week abortion ban, there's a 22-week that was about the period that you had until you could have access to abortion care. That too is unacceptable. There shouldn't be any type of time limits for folks because everyone's pregnancy and situation is different. And so we really want people who resonate with this campaign. This is a space for you to dream big, and the RFA is our opportunity to do that. And so for my calls to action, we'll be sure to follow up with everyone and share the RFA petition that we have. Additionally, we do have our working group partners that have lobby days coming up that people can participate in at the Georgia State Capitol. So on February 19th is Sparks Lobby Day. On March 4th is Urges Advocacy Day. And additionally, on February 24th, that is the Feminist Women's Health Center's Lobby Day. During these 3 advocacy/lobby days, we will be discussing the RFA and talking to our legislators. And just to remind folks, the RFA is being reintroduced on February 24th. And I'll pass it back to Allison.
Thank you, Amber. Next up is our section on maternal health, and this will be led by Brianna.
All right, thank you so much. So just really quickly, Allison already shared earlier that Georgia consistently ranks among the worst states for maternal health. We know that these adverse outcomes and experiences can be traced to inequities and challenges in access to care. But I really want to focus this evening on access to midwifery care and our efforts to address those barriers. So we heard earlier that large portions of the state are considered maternity care deserts. This is particularly troubling considering that giving birth in a hospital with a physician has become the default model of maternity care in the U.S. Yet for many communities in Georgia, they don't have either a hospital or an obstetrician. So we have to think about what access to care for pregnant people looks like. Couple that with the lack of diversity in healthcare professions, including both among physicians and nurses, it further exacerbates power inequities between pregnant patients and their providers, and it contributes to a lack of respectful, culturally competent maternal health care. And most people are not even aware that Georgia has some of the most restrictive midwifery laws in the nation, and they disproportionately impact Black direct entry midwives. For context, midwives that are able to practice in neighboring states like South Carolina, Tennessee, Florida, and Alabama, they would be criminalized if they practiced in Georgia. And these unnecessary restrictions placed on skilled midwives threaten the human right to bodily autonomy. And bodily autonomy extends beyond a person's decision to be pregnant or not to be pregnant, but it also includes a person's right to decide where and how and with whom they will experience childbirth. So to address this, we have to expand midwifery licensure in Georgia. And we're doing this by looking at ways to expand access to midwives across all training pathways, enacting laws and regulations that allow midwives to practice autonomously to the full extent of their training, expanding access to birth centers that are owned and operated by midwives, and ensuring equitable reimbursement rates for the care that midwives provide to their communities. So I'll stop there in the interest of time, but I hope that you'll join us. We're hoping that we'll have legislation introduced soon. Come out every Wednesday. We'll be out there lobbying for midwives. So help us join in this effort. I'll pass it back to you, Allison.
Thank you so much, Brianna, for your incredible work advocating for midwives and access to birth care. And the final piece of our bodies section is about fertility care. So I will send it back to Agbo to share about Spark's campaign. Oops, apologies for that.
Thank you. So glad to talk about this work again. Before I get into fertility care, I forgot to mention earlier that we do intend to introduce our bills on February 19th. That will be accompanied by an advocacy day, so we hope to see you there. Amplify should be providing more information on that. All right, so fertility care. So all Georgians, no matter their income, gender, or sexual orientation, need to have access to affordable fertility care so they can create the families they want. All families experience inclusive support like IVF, egg freezing, things like that, prohibitively expensive. The average cost of a single round of IVF is about $20,000 out of pocket. And for those seeking to freeze their eggs, that's about $15,000, and that doesn't include storage fees. Currently, Georgia does not mandate coverage for fertility care, despite the data revealing that nearly 2.1 million pregnant or 2.1 million folks who are able to give birth, ages 20 to 49, experience infertility in the state of Georgia. So this campaign is really about expanding that access. We want to guarantee equitable and non-discriminatory access to fertility care for all residents of Georgia, regardless of sex, gender identity, sexual orientation, race, disability, marital or relationship status, nationality, or other status, using a multi-pronged approach that includes awareness raising and proactive legislation. We recognize that a lot of folks are unaware of their options when it comes to fertility care. So a part of this campaign is not only passing this legislation, but also informing folks about what their options are. So this is another more legislation we hope to introduce this session as well. We will be holding another FTC Day on February 27th. Yes, February 27th, where we hope to introduce the bill as well as lobby our legislators about this important issue. Thank you.
Thank you, Agbo. So our next two sections on our bodies, on our families, and our communities will be presented by Ogechi Opara, who is the organizing manager at 9 to 5 Georgia.
Thank you so much. Super glad to be here. I just want to ground in this quote by Gwendolyn Brooks, which is, "We are each other's harvest. We are each other's business. We are each other's magnitude and bond." And when we pay attention to the people, we find that there are people daily making these decisions, making these really challenging decisions. And there are people, many, who are saying no. And we have to ask, why are people saying no to having a child, right? Especially in the state of Georgia. I hope you can hear in all that's been shared this evening that the pleading of women and families, men for their families, to not go through, to have the choice, is really an indicator of societal failures, right? And so, I was having this beautiful conversation with a colleague who I shared when I was going to be giving some remarks. And we were talking about an expansive view of reproductive justice, right? Which Rula and many others alluded to earlier, right? So how can we make it make sense for a child to be here by creating conditions that are less violent, right, than they are presently? And we can think about here in Georgia, in the United States, but we can think about this globally as well, right? What does it mean to reproduce harm at a societal level, to reproduce abandonment, disregard, trauma that's manifest in the absence of caring and generous policy design, right? And can we think about reproductive justice as breaking cycles of harm and reproducing cycles of care in the conditions that we create, right? And so at 9 to 5, we've been exploring this idea of the arc of the well woman. What a woman at all these stages of life needs to be well. When we invest in these supports, we reproduce children who are well, right? Families that are healthy and well, whole societies that are well, right? When we think about the arc of the well woman, we might start at this amazing news that a woman is pregnant, right? And we know that they're coming into conditions where it's more unsafe to go through pregnancy than to have an abortion, right? Maternal mortality, as we've heard, is one of the highest in Georgia. Now, a woman is going through with this pregnancy, and she needs to make her appointments to take time off from work. Maybe she is having a complicated pregnancy, and she may find that she's one of the 78% of people who don't have guaranteed access to paid leave, paid time off through their jobs, right? So that's why we're fighting on the Georgia Coalition for paid leave for all, right? Wages are still below the federal minimum wage in Georgia at $5.15. Wages have not increased. And we're not at a time when one person can work and one person can be at home. This is in order to be housed. These are essentials. And so a woman is at their job, and God forbid this woman faces discrimination for being pregnant. Georgia is one of 3 states with no workplace protections at the state level. And so if she has a claim, she has to file that claim with the EEOC, which, by the way, is only processing about 2% of the claims that come to it as an underfunded and overloaded agency, right? And so a woman, the family is at this job and they need to provide childcare. The child is out and healthy, right? We know that childcare is unaffordable, increasingly unaffordable in the state of Georgia. A recent study by the Georgia Budget and Policy Institute found that 140 of the 159 counties in Georgia deem infant care unaffordable, right? And so families are struggling to pay for childcare. They're finding it unaffordable. And so in the midst of all of these barriers, right, people are experiencing more stress, more desperation, and that has direct effects on the health and well-being of the child, certainly of the mother, of the entire family. And we can't go without stating that these are design flaws often based on racist ideas of who a worker is, who deserves to be paid fairly for their work, right? There's this mental resistance to considering compensating largely women's work. And so we really have to think about what this ends up having an impact on the woman, the child, the family. And I will just close here with my dad, and I told him I was going to be giving some remarks. He paused and he said, "Ah, a woman's health is a nation's health," right? And in how we imagine a more generous set of policies, we can also reimagine a more generous nation as well. Thank you so much for this time, and I will pass it back to our MC.
Thank you so much, Ogechi. Such incredible information being shared. We cannot let this portion around our agenda pass without also uplifting the critical queer and trans liberation that is so desperately needed now and always. We know that trans and LGBTQ people are under attack in Georgia. This past legislative session, there were over 20 anti-LGBTQ bills filed attacking trans young people and attacking medical care for trans Georgians. And we're already seeing more of the same this legislative session. So we are going to continue fighting back against these bills until all government and healthcare systems promote equality, inclusivity, and justice for trans and gender nonconforming people. And we also encourage you to take a look in the agenda. You will see a really beautiful proactive campaign from our partner Spark, who you heard from earlier, their Power in a Name campaign that will remove barriers by changing name and gender marker policies in Georgia. So be sure to check that out and support that work. You have all heard such incredible information about these proactive policies that our communities need to have real access to reproductive justice in our state. As was said earlier, if there were alignment underneath the Golden Dome, our capital, many of these policies could be passed this legislative session. But whether these are short or long-term goals, our legislators need to hear from us that the reproductive justice policy agenda is the roadmap, that we need them to focus on this legislative session and beyond. So we want to invite you to take action with us right now. My colleague is dropping a link in the chat, which will allow you to send a letter to your state representative and state senator, urging them to prioritize the reproductive justice agenda. You'll see that there's a pre-written template provided, but we definitely encourage you to personalize it with your own experience and your own perspective. But we invite you to take this action with us right now. And has been stated previously, we're going to be sharing more calls to action with you all. I am, speaking of legislators, I am so thrilled that we have 3 amazing state representatives here with us tonight, who I am so happy to be able to introduce. First, we are going to hear from Representative Shay Roberts, who is a longtime champion and has served as the lead sponsor of the Reproductive Freedom Act since it was introduced in 2023. We also just want to take a moment to give you all of the virtual flowers, Representative Roberts, and thank you so much for being such a strong ally in this work. Rep. Roberts is a mother, an attorney, a small business owner, and the Georgia State Representative for House District 52, which includes parts of Sandy Springs, Brookhaven, and Dunwoody. She was elected in 2020 and is now serving her 3rd term in the legislature. Rep. Roberts has been one of the strongest voices in the State House fighting for every Georgian to have an abundance of freedom, including the right to decide what's best for their future and their body. Rep. Roberts will again sponsor the RFA, which not only repeals Georgia's extreme 6-week abortion ban, but expands access to care for all who need it. So Rep. Roberts, I'm going to turn it over to you to speak for a moment about what you are seeing in your district as it relates to reproductive freedom and reproductive justice, and your plans to address it. Rep. Roberts, you're on mute.
I'm talking to no one. I'm so sorry. Thank you so much for having me. And I just want to say thank you to Amplify and all of the organizations that are under the collaborative, all of you, the work you're doing. It's so inspirational. And I wish we could do more down under the Gold Dome. We're not giving up hope. It is a struggle, though, because even though, like the polls showed, a majority of Georgians want access to care, unfortunately, we are not being represented by folks who agree with their own constituents, or they're beholden to somebody else. And so I'm looking forward to filing the RFA again. It's a dialogue I think we need to have. I think someone in the chat asked, are there any Republicans that might sign on? So right now, I think most of the Republican stance is that they're not going to even talk about it until the Supreme Court case is resolved, the appeal of the 6-week abortion ban. I think oral arguments were March 18th. But I can tell you that if we're so blessed that they do say that it's violates privacy or whatever claims they decide, that bill only passed by one vote. And we have increased our number, people who support abortion access in the state house. And so I don't think it would pass again. We've gone from, I think when it passed, maybe 72 Democrats to now 80. And so it would be hard for them to get those votes. A lot of our colleagues said privately when it was passed, oh, don't worry about it. Roe will take care of it. And so I'm just hoping that once that lawsuit is over, that maybe we can have some real conversations about this. But and then someone else asked about citizen-led ballot initiatives and referendums. I also filed last term, and I'm going to file again, the Representative Democracy Enforcement Act, which would amend our Constitution to allow for citizen-led ballot initiatives and referendums. I hear Republicans often say, let the people vote in the context of things that are important to them. But we haven't, they've got so much power right now that I don't know that this bill will be any more successful. But we think it's important to keep highlighting the fact that our representatives are not representing our interests when a majority of Georgians want access to care, expansion of Medicaid, there's so many things, common sense guns. So anyway, I'm going to keep fighting. We will keep talking to Republicans. And again, I'm just so grateful for your partnership in this.
Thank you so much, Rep. Roberts. We are incredibly grateful to you as well. Now I'm very honored to be able to introduce Representative Ann Allen Westbrook, another incredible champion who was also our lead sponsor on the Anti-Abortion Center legislation that you heard about earlier that's going to be introduced for the first time this legislative session. Rep. Westbrook, we also want to send you your flowers for being such an incredible champion for reproductive freedom. Representative Westbrook represents Georgia House District 163, a diverse district that includes downtown, midtown, and west side Savannah, in addition to Garden City. Vernonburg and portions of unincorporated Chatham County. Representative Westbrook earned her BA in political science from Hollins College with departmental honors. She went on to earn her Juris Doctor from the University of Georgia Law School. She's been practicing as an attorney since 2001, focusing primarily on divorce, custody, and other issues facing families. Before running for office, Representative Westbrook was the state legislative lead for the Georgia chapter of Moms Demand Action for Gun Sense in America. And as a volunteer leader, she's worked with the city of Savannah to unanimously pass a gun violence prevention resolution, the first of its kind in Georgia. Rep. Westbrook, thank you again for being here. And please just tell us a bit about what you are seeing in your district and any plans that you have to try to address those issues.
Thank you so much for having me. Thank you to all the panelists tonight. Every time I get together with Amplify, I just learn, and that's been the case again tonight. There's just so many of you doing incredible work, and I'm honored to be with you. I guess what I'm seeing in my district, really from the time the 6-week abortion ban passed, a lot of fear. And that's just a terrible state to be in. Whether it was, women posting in Facebook groups trying to find someone who would do a tubal ligation on them because the stakes are high, when we don't have access to healthcare and to reproductive freedom. Women telling their stories, which is, I guess, one of the good things to come out of this is, we can't afford to live with shame around some of these issues anymore. And so what I see in my district are women telling their stories and, basically putting a face on this. Complicated pregnancies, choices that they, weren't what they wanted to make, but what they were presented with. And so that's a lot of what I'm seeing. And it really does just personalize this and make us all understand that this is, what about a third of women are going to need access to abortion care at some point in their lives. I am this session going to be filing a suite of bills with Amplify to address crisis pregnancy centers, anti-abortion centers, whatever nomenclature you may choose, but basically clinics that aren't really clinics. They're organizations that exist to talk women out of exercising rights that we still have. We don't have enough of them. We have very, very limited circumstances under which we can access abortion, which is why it is all the more crucial that we cannot have fake clinics misleading women and giving women incorrect information, because there is such a tiny window for anyone to access these services that we absolutely cannot have clinics lying to women. We wouldn't allow that of any other business, and we absolutely cannot allow it here. Agba mentioned earlier on the call that, these clinics have been getting state funding for, I guess, over a decade now, or about a decade, $2 million a year. So, these are taxpayer dollars that are going to fund religious, faith-based, religiously affiliated, frequently clinics that don't actually offer healthcare services, but mislead, women into thinking that they do. And I think it's always the right of Georgia taxpayers to question whether they're getting the highest and best use of their dollars. And I think we can all agree that this is not it. We live in a state with tremendous, tremendous needs. We've heard about that so much tonight. I mean, we have so many needs in the realm of healthcare, but we have needs in the realm of childcare. So, for us to be just sort of allowing year after year after year, $2 million of state funding to go to these clinics is just kind of abhorrent. And so the legislation will be sort of two parts. One will deal with misleading advertising, and one will deal with basically excising that funding. And just for purposes of kind of having this conversation, we'll also look at ways to redirect those funds and really just stimulate a conversation, hopefully, about the best way to use those tax dollars. So I'm honored to be working with y'all on this, and I look forward to February 19th.
Thank you so much, Representative Westbrook. We cannot wait to raise this issue more in Georgia communities, because once people understand what is happening and how pregnant people who just need care are being deceived, and that the state is giving them $2 million a year when they can't give people regular maternal health care or other types of health care, it is people are very agitated and ready to take action. So we thank you again so much for allowing us to work with you around this issue. Representative Marvin Lim, I am so happy to get to introduce you now, another great ally in this work. Thank you so much for joining us tonight. Representative Marvin Lim represents citizens of House District 98, which includes portions of Gwinnett County. He was elected to the Georgia House of Representatives in 2020. Representative Lim immigrated to Georgia from the Philippines at the age of 7. Benefiting from various forms of public assistance growing up, he eventually earned his Bachelor's of Arts from Emory University, where he graduated magna cum laude. He performed job development for refugees and immigrants on behalf of Catholic Charities Atlanta and testified for the first time in the State House in 2009. He later obtained his Juris Doctor degree at Yale Law School, where he was awarded the Benjamin N. Cardozo Prize for Moot Court. Representative Lim has established a career in both civil rights and securities law, and has been with his law practice since 2015. Representative Lim, we are so happy to have you with us tonight. And again, we would love for you to share what are you seeing in your district, and any plans that you have this session or beyond to address those issues.
Thank you so much, Allison, and really to all of you doing the work day in and day out. And of course, to my colleagues, Representative Roberts and Westbrook. I will try to talk fast, accessible, but still fast. So I do represent a district in Gwinnett that is over 85% BIPOC and just under half immigrants like myself. My constituents are primarily from Latin America, as well as Africa and Southeast Asia. Diversity is a strength. I firmly believe that. On the other side of the equation, over 20% of our households are considered at or below federal poverty levels. And so what we're seeing in my district, and this is not specific to the now current administration, but it's certainly been exacerbated by it, is a lot of fear and misinformation that has led to harm. An unfortunate example of this is indeed a local anti-abortion center. Even in the past administration and a favorable political environment locally, because I like looking at government budgets, I found out just shortly before Dobbs was handed down that our local county government was competitively awarding federal pass-through funds to one of these centers. Now, we were able to stop some of that afterwards, but the problem still remains. I and others could not get HUD, that was the agency, to even try to issue a rule preventing this. Like at least the rule that you may know was proposed through preventing TANF funds from going to these centers. And certainly the current administration will not be interested. And so to me, that just underscores in yet another way the larger issue, how if people in power who have resources available themselves to inform themselves and to make those positive changes, we're doing that, then people who are disempowered, who have much fewer resources available to them, will be impacted by fear and misinformation. So for me, part of the response has been, of course, to be supportive of the legislative work led by those, again, doing the work and those most impacted. In the past session, I was asked to carry the Right to Contraception Act, which I did proudly. And I'm so grateful, again, to Representative Roberts and the Coalition for RFA. And given what I just said, especially to Representative Westbrook and her upcoming legislation regarding these fake clinics. But I did want to emphasize that I think a larger part of my own response has been simple engagement around these issues. And I think that's where we've had victories that seem small, but I think are significant. Last year in 2024, I was proud that 3 of our most well-attended programs I did was with Feminist Women's Health Center on this roundtable. We did 3 different iterations of a sexual and reproductive health education program in English and Spanish in a community setting. One of those was actually for teenage youth and in tandem in a separate room, their parents. And this is in a school district that, again, despite favorable political climates in our school board, does not still have a comprehensive sex ed, and in some places has instead had to emphasize an earlier point, our local anti-abortion center teach some of the abstinence-only education. The programs that we put forth are not otherwise available or accessible in my area. I've also been very proud to work with Spark, another organization on this roundtable, to create safe spaces around those who are transgender, and to work with Amplify a few years ago to translate their great critical reproductive freedom guide into multiple languages. And I cite all these as examples because while I'm certainly not the most impacted population by all of these policies and restrictions, it has allowed me to feel empowered and through two-way engagement and mutual empowerment of those who really need this information. Because as we know, people benefit from this information, not only to inform their decisions, but in my experience, to provide the start to engage these really hard to reach, traditionally marginalized populations to be able to take action, to make their voices. And oftentimes it is very important that they are, all the times really, able to voice their specific localized needs, tell their stories where they've never felt comfortable doing so, and to normalize these experiences that we know are not common but are heavily stigmatized. And because I'm glad that we have been able to make headway in some victories around redirecting the fake clinic funding locally, but of course it's not enough just to eliminate the bad. We can and should provide good. That was something I was also able to work on with Healthy Mothers, Healthy Babies. We got some funding, ARPA funding locally, directed through federal pass-through, of course, to expand their work in Gwinnett, specifically to connect Hispanic, Black, and other women to doulas and other culturally and linguistically appropriate maternal and infant health services. Overall, in my district, I have taken a very place-based approach, knowing that informational or informal networks are very important to information. So I'll close by saying that in the past week, especially with all of these executive orders, I and those I've worked with in the 215 or so distinct neighborhoods in my district have asked people in each of those neighborhoods to disseminate and engage their own networks around rights, know your rights around immigration, reproductive rights, and trans rights. Because again, we know it's only through those trusted networks that we will empower one another, again, not only to make the have our voices be heard to make that long-term change at the local, state, and federal levels. So more to come, but I'm very grateful and hopefully have shed some positive light on the actions we have been able to do.
Thank you so much, Rep. Lim, Rep. Roberts, Rep. Westbrook, for sharing your observations and how you are really championing this work at the Georgia legislature. I am incredibly mindful of time. I started off this session with gratitude for you taking time out of your busy schedule, likely caregiving simultaneously and juggling multiple commitments, and just to see how many folks have been able to stick around with us is just incredibly heartening. And I need to move us to a close to respect folks' time and to ensure that people are able to leave with some calls to actions and ways to stay engaged. So, and I will just note that the question and answers, y'all posed so many incredible questions throughout the session. We were able to get to them in writing with the Q&A tool. So if you would like to see what questions were answered, what answers were provided, you can go to that Q&A function and check out the responses along with some resources that were shared there, and we'll make sure to summarize them in our follow-up email. So calls to action, how you can continue to stay engaged. So first, I just want to re-up the call to action around contacting your representatives. You can use this link that we've provided in the slide deck, tinyurl.com/ask4rjga. We'll also be sharing this via email. That goes to Action Network, which allows you to auto-generate an email to your representative. So it is very user-friendly, very quick. And this really is something where the more folks that share this information, the more compelling it'll be to your representative. So we really encourage everybody to take literally 30 seconds to send this out to your representative. If you feel compelled, tailoring a message is also very useful. Next, I'll invite you to join us at our monthly reproductive justice community call, which will be happening next week. You can register for that call using the link provided again here, and we'll be following up via email. That's just an incredible space to learn more about our work, to connect with like-minded folks, and to take direct action as well in community with other people. And then the final way you can get engaged that I want to highlight tonight is through Sparks Advocacy Day. And that is happening on February 19th. Spark and Amplify and various other groups will be coming together to advocate for many of the policies that we highlighted this evening. It is an incredibly empowering experience. If that's your first time to the Capitol or your 10th time, I encourage you to come out and to really engage in our democratic process. because it still exists and we still need to fight for it to continue, and show our people power in numbers at the legislative session. So those are the 3 different ways we'd like to highlight, and we can also follow up with a few other key advocacy days that Amber noted earlier in this presentation. So thank you all so much. We'll conclude there. A huge, 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 huge round of applause to our incredible speakers and panelists. Thank you all for your time and your brilliance.